Coronavirus cases appear to be dropping after the Omicron variant causing numbers to spike. Joining us to talk about it all is Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna vaccine trial. Doctor, COVID cases, as we mentioned, many countries, many states appearing to be on the decline. Two questions with that. What's pushing the numbers down, and what do we need to do to avoid the mistakes of last summer when it seems we let our guard down a little too soon?
Well, I think that the biggest thing in terms of driving the cases down is that the virus is finding less people to be able to infect. And so the level of community immunity from either natural infection or vaccination is quite high. And so the virus is having less of a portal to get into people. And so I think that that's probably the biggest driver in terms of having these cases come down and come under control, and doing so very quickly. In terms of being able to avoid mistakes of last year when we may have let our guard down a little bit, I think it's important to continue to get vaccinated, to get boosted. Still only 30% of the country has gotten the booster shot. We need to improve that to get up to a good level to fight off the possibility of new variants coming at us, but also to continue to test if you're symptomatic and isolate if you're positive. Anything that we can do to isolate the virus and to prevent it from penetrating the community is going to be a true positive going forward.
You mentioned that natural immunity there. The CDC report recently acknowledges protection provided by those who contracted the virus, the natural immunity. What do you think people should do with that information when it comes to deciding how to protect themselves, and what shouldn't they do when they hear that information?
Well, in that report from the CDC, it is mentioned that probably the best protection that someone can get is the combination of the vaccine plus a natural infection. And certainly, we don't encourage people to get infected. There's things like long COVID and such that can happen when you have the infection. But if you've been infected before, get the vaccine or get the booster. Make sure that you have at least up to say 3 exposures. That meaning like 1 natural infection and 2 doses of the vaccine. Those 3 exposures really are going to provide a very good immunity going forward. Probably 3 vaccines is still the best way to go and the best way to avoid getting sick. But 3 exposures, I think, is really a key number to keep in mind.
And we got about 30 seconds left, Doctor. A lot of the video we're just showing is adults getting their vaccination shots. Push now to have kids 5 and under, as young as 6 months, vaccinated. Your thoughts on that? What do parents need to know?
Right. This was huge news this week when Pfizer applied for the EUA for the under 5-year-old group, which is the last group to be eligible for the vaccine. This is a vulnerable group. This is a group that goes to school, spends a lot of time indoors. They are a source of infection within the community, even if they don't necessarily get terribly sick themselves. Consider getting those vaccines into your child's arms, really to give this community, to give our whole society the protection it needs.
Dr. Bill Hartman, UW Health, as always, thanks.
Thank you.